Hello, I'm Dr. Thomas Deering. I'm a cardiac electrophysiologist who works with Piedmont Heart. Patients who have underlying valve abnormalities have a predisposition towards rhythm disturbances. And that can manifest at three different levels. They have a tendency towards bradyarrhythmias, they have a tendency towards atrial fibrillation, and in some cases they have a tendency towards ventricular tachycardia. Probably the most common rhythm problem that valve patients have is atrial fibrillation. And patients can present to a primary care doc or to a cardiologist in a number of different manners. Sometimes they'll have the classic palpitations or a racing heartbeat sensation. Sometimes they'll have syncope. Sometimes they'll just have a decrease in their exercise tolerance or capacity. So sometimes it's obvious to the referring physician or to the patient. Sometimes it's more subtle in the way they present. So one needs to have a good way of looking for this problem and trying to investigate it further. When they have these problems, whether they be bradyarrhythmias, whether they be atrial fibrillation, or whether they be ventricular tachycardia, they do need further treatment and they do need further evaluation. Valve patients have less of a reserve than many other heart patients do, or many patients who are obviously normal do. As a result, they need to be treated aggressively to make sure that those slow heartbeats, the bradyarrhythmias, don't lead to clinical problems, or the rapid rates from atrial fibrillation, for example, don't lead to decompensation, which can happen. In addition to that, the ventricular tachycardias, although less frequent, are often the most serious and potentially life-threatening. So a patient with an underlying valve problem who presents with syncope definitely needs to be evaluated aggressively. The others need to be approached moderately aggressively. At Piedmont Heart, we work together as cardiac electrophysiologists with the valve team. So if a patient has valve problems and they're dealing with that issue and they subsequently determine that arrhythmic issues are present, we will actually work with them on that. Conversely, we sometimes see patients who have rhythm issues, and in the workup for those rhythm issues, we determine that they have a valve problem. In that case, we engage our valve patients. So in treating the patient with valve disorders who also has arrhythmic issues, there is overlap, and fortunately having a team, we can work together so that the patient gets the appropriate care at the appropriate time.